We got a bunch of questions that came in, so we're going to jump right into it. Remember that you can chat in your questions as well. Hopefully, I will see the chat. There's multiple chat bars here, so I can look at it. So feel free to chat in a question as we go here too. So let's start off with the first question that was submitted. And I always remember that on our website for the Holistic Health Hour, that's where you could submit questions beforehand. Obviously, there's people finding it. So here are some of the questions. First question: how might drinking alkaline water affect your body's hydration? Now, I'm going to phrase this question two ways because I'm assuming this person is asking, will drinking alkaline water affect your hydration? Knowing that my philosophy of drinking alkaline water is not a good idea. So let's start with that, just so everybody who may not have asked this question understands that. I don't think it's a good idea to drink alkalized water. And the reason is that your stomach pH has to remain at a very low level, a very acidic pH. And if your stomach gets too alkaline, all sorts of bad things will happen. And I have several blog posts on that. The need for HCl production by your stomach cells, and the problem with your stomach cells not being able to produce HCl, very, very common, maybe the most common thing that causes ill health. We always talk about leaky gut issues and inflammation in the gut. Well, it can all start with a decreased ability to produce HCl. And what are you doing when you take PPIs or you're taking even Tums or something like that? These medications that block HCl production, they can give you temporary relief from like an acidic burp up of reflux of acid, but always those symptoms of acidic coming up your esophagus and affecting your esophagus and you tasting acid in your mouth and this reflux issues are all from, ironically, a decreased HCl production. You're not getting enough HCl production. It's not breaking down the bolus food in your stomach. And then what is there is being pushed up through the esophagus and then you're burping that out. So ironically, you need more HCl when you get reflux. And people are going and they're taking Tums, Rolaids, going to get PPIs, which is you're setting yourself up for very, very serious diseases when you do that. So I have several blog posts on that. But does drinking alkaline water affect body's hydration? No. So if you're drinking alkaline water, it will be acidified by if you have decent HCl in your stomach. So there's no benefit of drinking alkaline water. And all the alkaline water companies that are pushing alkaline water because it alkalizes your body, it's just completely wrong physiology. So it doesn't stay alkaline. Once again, it's into your small intestine. By that time, it's not alkaline, it's just water. So if they're alkalizing it with using minerals to alkalize it or something like that, then you're maybe absorbing those minerals. Typically, they're not going to use good quality minerals to alkalize it anyhow. So it can be even more harmful. If they're using poor quality minerals, then you are actually blocking absorption sites for good quality minerals. So um, I have several videos on good supplements, bad supplements. So poor quality minerals and consumption of poor quality minerals, typically in supplementation, poor quality supplements, or like grains and things that have fortified minerals. It's typically really poor quality minerals that can actually block absorption sites for if you're eating good food with good quality minerals. So there's a lot of things why you shouldn't drink alkaline water. But is it affecting your body's hydration? Um, no, it as far as hydrating goes, it's probably the exact same if you're drinking regular water. So whether you're acidifying your water by adding, let's say, lemon juice to it, or apple cider vinegar to it, or you're alkalizing water, buying a prescribed alkalized water drink, or getting one of those alkalizing water machines, it's not affecting your hydration. It's still going to be absorbed as water. So it still is good for hydration. It's just bad for your gut. as far as alkalized water goes. Next question. I heard that fluoride in toothpaste and drinking water is not the same as the type of fluoride used in studies showing benefits for teeth. What are your thoughts on this and the misleading information on fluoride being good for you as opposed to highly toxic? So I wouldn't dispute that fluoride, using fluoride toothpaste and things may be beneficial for your teeth. Fluoride is, in the classification basically of a heavy metal, and it will, be substituted as calcium in your teeth, and it can make your teeth harder, and it can possibly even prevent cavities. I mean, I wouldn't doubt that. Is it the right thing for it? No. Is it toxic? Highly toxic. So there's no way that you could even putting a fluoride treatment on a tooth, which I think a dentist can do that with a topical, like they paint on a fluoride treatment on a tooth. Still, it's going to slough off into your system, and it's going to act like a heavy metal. It could cross the blood-brain barrier. It can damage neurons. It can be the cause of microglial priming. It can damage cells. It's going to be stored in fat cells. It can be the cause of DNA damage and a cause of cancer. So there's no way a person should be using fluoride toothpaste. There's no way a person should be accepting fluoride from their dentist. I don't care what it does to your teeth. Still, that fluoride is not the desired nutrient to make your teeth harder. It's calcium in the right form to help make your teeth more dense and harder. So no way I think fluoride should be used in human consumption of any kind or human exposure of any kind. It's highly toxic. That's my opinion, and I'm sticking to it. Reading about this product, GCMAF, because my friend is taking it at Hope for Cancer and wondering why we don't all take these types of things intermittently, regardless of an issue. Could these be useful as a preventative? Is this something that can be purchased by other friends struggling with cancer in the U.S.? So GCMAF is a product that stimulates macrophage production and stimulates macrophage attack to cancer cells. It was a product that was originally made in England years ago, decades ago, and studies were done on it that it was very beneficial, and it was an injectable. So it stimulated macrophage attack on cancer cells. Very promising therapy, but it wasn't something that was patentable because it was made from vitamin D and through I think it was omega-9 fatty acids. So it was a synthesis of vitamin D and omega-9 fatty acids. Well, that factory that was making that and the practitioner that was doing the studies, the company that was doing it, got shut down by the British Medical Association, which isn't much different as far as their authoritarian Nazi-like function as the AMA and the FDA here in the United States. So they got shut down and disbanded, and information was taken, and not a good scene. Then a number of years later, there's a company in New Zealand or something like that started up making it again. It's not something that we use in our office because we don't do injectables. We don't do anything that it would be beyond our scope. But the practitioners that I spoke to that used it were not happy. So they were using the original GCMAF, and then they started using the new GCMAF that began maybe 10 years ago. And that's what, to my knowledge, is still available today. The practitioners that were using the old and switched to the new said it was just different. It wasn't made the same way. They weren't getting the same results. Now, I do realize that there's clinics in Mexico that still use that. I think there may be even clinics in the U.S. that still use that. Understand that is just one therapy, one of many, many therapies that you could do to help with a person with cancer. Alternative therapies I'm talking about. That's just one. There's many more that I write about it in my book. There's many more that I comment on and have videos on our website. So do go on our website and look at our blog posts. I think we have well over 1,000 blog posts on different things with cancer. However, so the question is, can a person use this preventatively? I don't know where you would get that for preventative use. Personally, I wouldn't use it for preventative use. I would use other things that would more naturally stimulate my immune system. I would do things to help with detoxification pathways from a preventative basis. I would do things that would help prevent the causes of cancer. That would help. Another really good thing to do is to do a full genetic workup. I don't have cancer, so I don't want to get cancer. Should you do a full genetic workup? Yes, that would be really good. What you see very commonly with cancer patients is deficiencies or issues from a genetic standpoint with their detoxification pathways. So if you can't detoxify chemicals like fluoride from a question a minute ago, things like that can settle in your body and get inside a cell. Remember, cancer is cells that are damaged. The DNA is damaged and they're in rapid replication, and they're replicating cells that are in rapid replication. What causes that? Well, it's not genetics that cause that, but something got inside that cell and damaged the nucleus, the DNA in the nucleus. So what is that something? Well, it could be a virus, could be a bacteria. Most commonly, it's a toxin. So we're exposed to these chemicals, exposed to these toxins. They get inside the cell. They can just sit there inertly until we die, but they can also damage the mitochondria. They can damage the nucleus. They can damage other organelles in the cell, causing ill health and certainly causing cancer. So from a preventative standpoint for cancer, I would really look at detoxification pathways and trying to keep my toxic exposure to a minimum as best I possibly can, than to think about doing like a GCMAF. So that's just my opinion. Okay. Recommended adaptogen that is great for reducing cortisol and inflammation, but also one that does not increase estrogen. I have a history of estrogen dominance, uterine cancer, and cannot risk increasing estrogen, but also need to support my cortisol levels. So I think this question stems off of, I've written some information about some adaptogens that can be estrogenic. I'm trying to think of which ones were more estrogenic than the other ones. Maybe it'll come to me, but it's that can be an issue. But with anything like this, I would suggest you measure your hormones. So this is something that's missed almost across the board in with oncology. I just don't get it. They'll tell women that they're ER, PR positive, or HER2 positive, but then they'll never measure their estrogens. I just don't understand it. I mean, it's just here, you're going to have to take this this aromatase inhibitor for the next 10 years. Why? Because that's what we do. Why do we do it? Unfortunately, the truth behind that is because that's what the pharmaceutical company told us to do. So if I don't do this and I don't recommend this, I can get in trouble, and now I can even be sued because I'm not doing what's called standards of care. Well, who wrote standards of care? Well, the pharmaceutical company. Well, aren't they the ones who sell the product that you're trying to push on me? Oh, well, just ignore that fact. So the truth is that, yeah, you should be conscious of your estrogens, but shouldn't you measure them? And you should, doing a Dutch test can be a great test to measure your hormones. So you don't just have estrogen and progesterone and testosterone. You have all these intermediate metabolites. So you want to look at the 2-hydroxy, the 4-hydroxy, and the 16-hydroxy esterones. That's the E1. And these are the ones that can be issues. The 4 and the 16 can be issues. So you want to look at those and measure those. Some people can be exposed to not just different adaptogens, but other things in their environment that can stimulate estrogen production or that can act like xenoestrogens in their body and not somebody else's. So measuring that can be very beneficial. Um, so there are different adaptogens that can help reduce cortisol, but I also would recommend that you measure your cortisol. So we always think of everything in the body is, either all good or all bad because we read some article about it or because that's the kind of the current hype in the natural scene. And cortisol always gets the bad rap, right? Excess cortisol, it's a stress hormone, and we don't want cortisol, and cortisol is my problem, and cortisol is why I can't go to sleep at night, and cortisol is this. Well, you can't blame something that you don't measure. So that might not be true. There's lots of reasons why a person can't fall asleep at night. Lots of reasons why a person, can't lose weight. There's lots of reasons why that we're giving a bad rap to something. We need to measure it. So measuring cortisol levels can be very beneficial. I can't tell you how many people that you do a Dutch test and you do a Dutch complete, which does have a cortisol measurement in it too, and their cortisol levels are down in the dump. So they have adrenal fatigue is what they have, or adrenal burnout. So their adrenals are burned out. They're not getting enough cortisol. If you don't have enough cortisol, remember, everything's not bad or everything's not good. It's about balance. If you don't have a balance of cortisol in your body, you won't break down glucose. You won't break down glycogen stores. You will have tons of brain fog and issues because your brain needs glucose in order to feed off of it. If you don't have enough glucose for your brain, especially at night, you're going to have all sorts of issues waking up at night and such. And it's a decreased amount of cortisol. So we need to build up the adrenal glands. So then maybe it's adrenal tissue that person needs, not so much an adaptogen. Maybe they need pituitary tissue to help stimulate adrenal flow. So there's lots of different things that we want to look at. So we certainly don't want to, if you have a history of uterine cancer or a history of breast cancer that was hormone driven, you want to look at xenoestrogens. You want to look at estrogen levels and those bad estrogen levels. So running a Dutch test would be the best thing to do. You really want to measure it. Okay, next question. What are the benefits of zeolite, and is it worth taking, or are there other foods, herbs, minerals that have the same benefits that could be safer or a more affordable option? So zeolite is really a chelator. So there's a difference between a binder and a chelator. So a binder is something, in my definition, is something that's really going to stay in your gut. You're not going to really absorb a lot of it. You may absorb some, but it really does its main function in the gut. Now, zeolite functions as a binder because it does bind stuff in the gut. And what would it be the purpose of a binder? So why would you take something that would bind stuff in the gut? So the purpose of that is when your liver goes, when bad things, chemicals flow through your bloodstream, you breathe them in, let's say, you get them on your skin, you spill gasoline on you eat something that has chemicals in it, and you absorb those. It goes into the bloodstream, circulates around the bloodstream, eventually goes through the liver, and the liver pulls it out through phase 1, phase 2, and then through phase 3 detox pathway, puts it into bile. It gets secreted through the bile duct into the gallbladder and then out into the duodenum, hopefully to be deposited into the toilet at the next bowel movement. Now, the problem is these toxins can dislodge from the fatty bile and can be reabsorbed. And we don't want to do that, especially if a person has issues with constipation and things. They may be reabsorbing a lot of toxins. And so you would eat things that act as a binder. So from a dietary standpoint, things that would act as a binder would be indigestible fiber. All fiber would actually act like a binder. Indigestible fiber acts also as a fuel source to the epithelial cells of the lining that line the intestinal tract. It could really be a beneficial fuel for helping those replenish themselves. But fiber can be a binder. So other things like minerals or humite and fumic acid can be binders. There's shiite that can be a great binder. Bentonite clay can be a binder. Um, so those would be mainly, some of those are found in foods, but some of those things are found in supplements as well. Zeolite can act as a binder too. So the purpose of a binder, again, is to grab onto things in the intestine so that you, toxins in the intestine, so that you don't reabsorb them, so that they get deposited into the toilet. Zeolite also acts like a chelator. So a chelator would be something that you absorb and that grabs onto things in your bloodstreams or in bloodstream or in the tissues and pulls it into the bloodstream to then go through liver, phase 1, phase 2, phase 3, and all the way out and get bound in the intestines and deposited in the toilet. So zeolite acts as both of those. So zeolite can be a good chelator. Now, the process of chelating toxins out of your system, out of your tissue, sounds like a fantastic idea. Oh, I should do that because everybody's toxic, and boy, I should start taking some chelators. Well, I highly recommend that you go back and either take my course on the 7 phases of detox, because you have to know before you start chelating, which I call phase 0, you have to make sure phase 1, 2, 3, 4, 5, 6 is open and working well. Because if you start chelating out of the tissues and you have a backup in the liver, it's just going to dump that toxin somewhere else, and you've not made yourself any healthier. You could actually make yourself much sicker. So either look at that course. It's super cheap to buy the course and start watching that. I think I have several videos of that course on our video site. I think I have multiple blog posts about that also. So look at 7 phases of detox. Just go on our website into the blog and search 7 phases of detox, or go to our video site and go into the search and type in 7 phases of detox. Also understand it, since I'm talking about that, it reminded me we were having trouble with YouTube pulling down videos because of quote unquote medical misinformation. And this video will probably pull down because I said something that their AI will pick up and say, this is wrong. We don't approve it. Oh yeah, what did I say? Did I bash the AMA or something like that? So that's not going to go well with them. So Dustin, who works at Cutter's Clinic here, does a fantastic job. It was a good plug, wasn't it? After I told him last week that he volunteered some other therapy. He did a fantastic job at putting up our own private video site. So we're tired of getting our YouTube videos pulled. And we're tired of getting our information pulled. We're tired of getting the AMA bashing us and all this kind of stuff. Well, we'll try to go completely private. We've always had videos on Brighteon and some other things like that, but personally, I don't really go to those channels. We wanted our own video site. So go to the video site. There's links on our website to the video site, and that will help you understand those things. So as far as other options from zeolite that are more affordable options, from a dietary standpoint, make sure you eat a lot of fiber. And from just a normal health site perspective, you want to make sure that your detox pathways are open. And that has to do with making sure that you're having daily bowel movements, at least one a day, that you're really cleaning yourself out, that your gallbladder is working well. And you can take supplements for that, using hot packs over your gallbladder. Learn how to do coffee enemas. One of the best things for your gallbladder and your liver and your detox pathways and your anxiety and stimulating your parasympathetic system and all sorts of things. So you'll learn all about that on that course if you do take the 7 Phases of Detox course. Next question. First of all, thank you for the very good interview live yesterday with the maker of the TrueRife machine. Yes, thank you. We just got that up. We actually did that interview a long time ago. Mike doesn't own the company anymore, but it's been a great resource. I was wondering if you have any experience with using Rife for issues such as skin cancer, heart-related conditions, and stabilizing blood pressure. Well, you could call our office, and who will most likely answer is Maureen, and she will talk to you about using the Rife for heart issues because I've written programs for her for that. But there are programs on the Rife for a lot of things. So, but there's some. So understand, the Rife is a tool. So you got to use a tool correctly. You don't use a screwdriver to pound in a nail. That's not. You could do it. It's not going to be very effective. So the same thing with the Rife. The Rife is using light frequencies. So if I have, let's say I have mercury toxicity, am I going to use a Rife machine to detox mercury? Well, it's not going to do anything to chelate mercury out of your body. Well, could I run liver programs? Would it help my liver function better? Yes, it would. So indirectly, it's going to help with that. It's not going to pull mercury out of the tissues to get to the liver, but it could help your liver work better. Could I run it on my kidney to help my kidney function? Yeah, well, for sure. Yes. Could I kill skin cancer with it? Yes, you can. So, but there's different types of skin cancer. So the question was, do you have experience using the Rife for skin cancer? Yes. So the more deadly skin cancer is the most deadly is melanoma. So the three most common skin cancers are melanoma, that can be the most deadly, squamous cell, which can also be deadly, and then basal cell, which is rarely um, deadly. So if a person calls and does a case review with me and they have basal cell cancer, would I recommend a Rife machine? Well, it really depends on their budget. So honestly, if you don't have any cancer and you just want a good healing tool for your house, I would highly recommend a Rife machine. It can be good for all sorts of things. So I don't have any skin cancer. What do I have? Well, I have kids. My kids get colds, or I don't have kids, but I get colds. I want to stay healthy, especially in this environment where I'm kind of don't want to go to the doctor anymore. The Rife machine can be a great tool. Comes with 2,500 different programs, from anything from macular degeneration to headaches to inflammation, swelling, to viruses, to bacteria, to just about everything you can think of. But it's going to work better on different things. So it's going to work better on killing living things. It's going to work better on bringing frequency harmony to your tissues. So it can help all your organs work better. But it really shines when you're trying to kill something living, when you're trying to kill cancer cells, you're trying to get your immune system to attack a cancer cell. It can kill bacteria and viruses and pathogens directly, because they are not as stable molecules, so not as stable organisms. Let's take viruses out of that classification. But viruses technically aren't really living. They're only reproduce when they get inside your cell, but it can help stimulate your immune system to attack that virus and kill that virus. That's what we need. So it can be a great tool to answer the person's question, yes, it can be a great tool for skin cancer. If a patient calls and they have squamous cell or melanoma, absolutely, you got to get a Rife machine. If you have basal cell, well, will a Rife machine help? Yes, but I do think you should do other things topically to basal cell cancer. So there's all sorts of different therapies that you could use for basal cell cancer that we have used, from essential oils to curcumin cream that we make in our office, to there's some things that you can purchase. There's B17 topical cream that we have in our store, and there's some other skin topical creams that people can use as well. As far as using the Rife for heart-related conditions, yes, it can be extremely helpful. Remember, on heart-related conditions, I would highly recommend, if you have any heart-related conditions, whether it be high blood pressure or a history of any type of endothelial disorder, to make sure that you go on our website and search for H. pylori and read those blogs and watch some of the videos that I created on H. pylori, because H. pylori is a major player with heart conditions. Also, look at possible Lyme disease and heavy metal toxicity. So the three major players that are causes of blood pressure and heart disease of all kinds are H. pylori, Lyme disease, heavy metal toxicities, and other chronic infections that could get under the endothelial lining and affect the receptors of the muscles that cause constriction of the muscles, and that's what causes high blood pressure. So look at that as well. But the rife is a fantastic killer of anything living, like I said. So it is, you should be running H. pylori frequency. So if you already have a rife and you have these conditions, you should be running. There's blood pressure programs on the rife. There's skin cancer programs, I think, on the rife, and there's definitely H. pylori on the rife that you should be running those programs. Okay, so this is a question, obviously, from a rife user. Is it normal for the hammer bulb to get super hot while I sleep with it? So the hammer bulb with the rife machine is typically used for overnight use. It's a tube encased in it's a tube of a bulb that's, I don't know, 3/4 inch diameter, encased in a maybe 3-inch, 2.5 inch diameter plexiglass tube, and it's meant to sleep at night with, and it's meant to protect it so that if you roll over and it falls out of bed, it's not going to break. But yes, it could heat up. Typically, you got those under the covers anyhow, and it's under the cover next to you, so it's not getting a lot of air circulation, and yes, it heats up. So the older hammer bulbs did not have a hole in the plexiglass, and they even got warmer. The newer hammer bulbs now have a hole in the plexiglass to release some of the heat, but if you got them covered by blankets, they can still get quite hot. So, I mean, not hot, they're going to burn you or anything like that, but it can be uncomfortably hot in the middle of the summer. So, yes, that's normal, and there's nothing you can do about it. So just make sure you take it under the cover and just cool it off a second. Typically, you're not going to have any problems with it heating up. And our last question that came in: what are the best supplements to take to help prevent colds and flu? We have a product that has, pretty much everything in it just to stimulate a normal, healthy immune response for colds and flus and, viruses, and that's called our Clear CV. Clear CV for cold and virus, or I don't know, what do we call it Clear CV for? I don't know, not for coronavirus. I know it wasn't for that, but could be. So this video's for sure going to get banned. So the Clear CV is something. It's one of our bigger sellers. It's got zinc and everything in it you need to help for a virus, colds, flus, to stimulate a healthy immune response. Obviously, there's other things that I am big into for your immune response. That would be medicinal mushrooms. One of my favorite for cancer, because medicinal mushrooms really act as an immune regulator. So if you're hyperimmune, so if a person has an autoimmune disease, you don't necessarily want to take a product like Clear CV on a regular basis. If you feel like a cold's coming on, you feel like the flu's coming on, taking it for a period of time, a week or two, is fine. But if you have an autoimmune disease, you have Hashimoto's, or you think you have an autoimmune disease, or you've been diagnosed with rheumatoid or something like that, then I would not take Clear CV on a regular basis. Taking mushrooms, though, can be safer because they're not going to be this giant immune stimulator. They will be more of an immune regulator. So if your immune system is suppressed because of an infection, then it will help build that white blood cell count back up. And if it's overly expressed because of an autoimmune issue, it can help actually bring it down, which is kind of nice. So you don't get that really hyper push of white blood cell count with mushrooms unless it is suppressed. And always another thing you should look at too, and I forget to mention this, is getting some blood work done. So getting a CBC and a complete metabolic panel done. And if you're a course member of ours, remember you can order blood work off our course. We don't mark it up at all. And you get a local doctor, local to your state, that signs off on it. So it's all legal and everything. And then you can go get a blood draw. I would highly recommend the complete wellness panel. That gives you a complete CBC, complete metabolic panel, complete thyroid panel, and some other things that could be really beneficial to really analyze an infection or not. So if your white blood cell count is elevated beyond 7.5 or 8.0, you definitely have a current infection. And then you look at neutrophils and lymphocytes to kind of give you some discernment whether it's a virus or a bacteria. That gives you a good idea of how to best treat that as well. So, good. We answered those questions. Hopefully that was helpful for everybody. And make sure you go to our site to look at past calls as well. We have those nicely laid out on the Holistic Health Hour site. Dustin did a great job of putting them into like blog posts. And there you can ask questions. So jump on that and ask questions, and we will be good. Thanks so much. Bye-bye.